In this video, we are going to see one of the important peripheral parasympathetic ganglion, that is the Otic Ganglion, which you can see as a small rounded structure over this region. Before going into the Otic Ganglion, let's get oriented with the diagram. This diagram is a medial view for showing the proper relation and position of the Otic Ganglion. Usually the dissected diagrams will be from the lateral aspect. We will be seeing from the lateral view, but in this diagram we are seeing from the medial side. So the Otic Ganglion, it is a small oval parasympathetic ganglion about 2 to 3 millimeter in size and situated in the infratemporal fossa. This region will be the infratemporal fossa. And the topographically, the Otic Ganglion is connected with the mandibular nerve, which is lying on the lateral aspect of the Otic Ganglion, mandibular nerve. But functionally, it is associated with the glossopharyngeal nerve, that we will be discussing that later. First, about the situation of the Otic Ganglion. This ganglion lies immediately below the foramen ovale. This is the region of the foramen ovale where the mandibular nerve emerges outside the cranium. So it lies immediately below the foramen ovale. Now, it is medial to the trunk of the mandibular nerve. It's very clear from the diagram. This trunk of the mandibular nerve is lying lateral to the Otic Ganglion. It is lateral to the tensor veli palatini. This is the tensor veli palatini. We are seeing a little bit from the posterior aspect. That's why this is not appearing as lateral, but in the proper anatomical position, this is the tensor veli palatini, and this ganglion lies lateral to the tensor veli palatini. Now, posteriorly, you have this is the middle meningeal artery, which is a branch of the maxillary artery, and behind or anteriorly, you have the medial pterygoid muscle. So, this is the anterior relation of the Otic Ganglion. This ganglion surrounds the origin of the nerve to the medial pterygoid muscle. This is the nerve to the medial pterygoid, and this ganglion, it surrounds the origin of this particular nerve. It has two roots, Otic Ganglion. The first one is parasympathetic or motor root. It is derived from the inferior salivatory nucleus, and it is coming to the Otic Ganglion through the lesser petrosal nerves. This is the lesser petrosal nerve. Through this nerve, the peripheral parasympathetic information will reach us the Otic Ganglion. Now, the sympathetic root, that is derived from the nerve plexus around the middle meningeal artery. This is the middle meningeal artery, and the nerve plexus around the middle meningeal artery will give sympathetic root to the Otic Ganglion. Now we will see the post-ganglionic branches of the Otic Ganglion. So, what happens to the post-ganglionic parasympathetic fibers? They arise from the ganglion and they pass through the two roots of the auriculotemporal nerve and they reaches the parotid gland. What happens to the post-ganglionic sympathetic fibers? They pass through the ganglion without interruption, and they also pass through the auriculotemporal nerve to provide mainly the vasomotor supply to the parotid gland. Then the fibers from the mandibular nerve to the medial pterygoid, that is passing through the ganglion without interruption, and this nerve is going to supply the tensor veli palatini and the tensor tympani muscles. The Otic Ganglion is connected to the cauda tympani nerve also. This is the cauda tympani nerve.